A monster cyclone is slamming parts of India and Bangladesh, adding more challenges to the coronavirus crisis. The powerful storm is dumping heavy rain, 100-mile-per-hour winds, and coastal flooding across the region. Millions of people evacuated as relief efforts get underway. Besides the cyclone, India is, of course, also juggling a tough pandemic response. There's more than 108,000 confirmed cases, many of those in Mumbai. A New York Times article takes a closer look at the city's overcrowded slums, packed hospitals, and the government response. Jeffrey Gettleman wrote that article. He's the South Asia Bureau Chief for the New York Times, and he is following the latest in New Delhi, and he joins us now. Jeffrey, welcome back to CBSN. Thanks for joining us. I want to start with your piece on Mumbai. You write that the city has suffered the worst. Can you take us through the latest there and why the situation is so dire?
Yeah, it's sad. Mumbai is this huge, really interesting city. It's India's commercial capital. About 20 million people live there. And it has many very densely populated slums where people live in these tiny shacks, one after the other, sometimes 8 or 10 people to a room. And they're packed in these labyrinths of neighborhoods where the spaces between the houses can be, less than a few feet. And the virus has entered these areas, the coronavirus, and it is spreading house to house. And there's now 20,000 cases in Mumbai, about 20% of India's total. Now, that might not sound like, compared to New York City or London or other big cities, that's not that much. But India's testing is much lower than many other countries. So the fear is that's just the tip of the iceberg, and there's many more people affected in these areas.
When I saw the headline for your article and this sort of started to dive in, I was initially surprised because India had been praised for its early widespread lockdown, certainly compared to other countries. But then as I delved in and you talked about the slums and the difficulty because people are living on top of each other, it's getting hotter and hotter out there. I thought, yeah, this totally makes sense. But I'm wondering, is the government doing anything in terms of intervention? Is there anything the government can do when we're talking about, slums that are almost the size of sort of small cities?
Well, you hit the point, really, really well. It's about social distancing, and it's really hard in these neighborhoods to maintain social distancing. And it is getting hot. It's getting 90 degrees, 95 degrees, very humid. So at night, people feel very cooped up, and they're coming out into the little alleyways, and they're intermingling, and that's spreading the virus person to person. The government really can't do too much. I mean, they put police officers on the streets. They're getting hot and tired and frustrated and exhausted. I think like 1,000 people in the state, that includes Mumbai, 1,000 police officers have come down with coronavirus. Several have died. And this is what India was really worried about. It was worried about the coronavirus entering really crowded places, poor places, and spreading like wildfire. And so far that hasn't happened in most parts of the country. There was a really strict lockdown for 2 months. Almost nothing was moving on the streets. The government closed down domestic airlines, international arrivals, all schools, parks, businesses, weddings, funerals. This society really came to a screeching halt. And that has kept the numbers pretty low, but there's been a lot of pressure to relax that because a lot of people are out of work. They don't have enough money to pay for the meals and the food for their families. And there's been this, real pressure for the government to relax the restrictions a little bit. And as they've done that, these cases are increasing. And that's where we're at now, in this kind of in-between period where the lockdown is still in effect, but the rules are a little less strict and the cases are increasing.
And Jeffrey, you and a great newspaper photographer teamed up for this article to focus on the slums and the migrant workers in Mumbai. What's clear is that this pandemic is hitting certain countries that have inequalities and inequities within the healthcare systems of those respective countries in greater numbers than in countries where that isn't the case. So what's the government doing to help this sector of the population to stay safe and, more importantly, to get medical attention right now?
It's really hard. I mean, India relies on what they call migrant laborers, people that live in the countryside and gravitate towards the big cities like Mumbai or New Delhi, where I am. And they provide the backbone of the economy. They're the rickshaw drivers, the people cleaning the streets, working in the restaurants, driving the trucks, working in the factories. A lot of these people aren't native inhabitants of these cities. And as soon as this lockdown was put into place, because it was so severe, millions of people began pouring out of the cities, going back to their native villages. And that spread the virus from the cities into the countryside. And that created this huge wave of displacement that India has never really seen before. And now the government is in this position where they're trying to help people, but they're on the move. So how do you get them food? How do you get them medical care? How do you enforce social distancing when you have groups of people lining up to take trains or buses to get back home? I think the government was caught off guard. They've gotten a lot of credit for enforcing the lockdown early and unequivocally. A lot of other countries sent out this mixed message, you know, Italy, the US, England, right? They all did this sort of the same thing. At first they struggled with the, you know, embracing a lockdown, and then they said we got to do it, but many people had already received this kind of mixed message and they didn't know what to do. India from the beginning said this is a dangerous disease. Your best chances are avoiding contact with other people, stay indoors. And tens of millions, if not hundreds of millions of people follow those instructions to a T.
Listen, Jeff, before we let you go, I got to ask you about the cyclone that's hitting, as if India doesn't need anything else, but we've got a cyclone that's hitting India's coast. Give us the latest on that. What's going on? What are the predictions?
Yeah, I've been covering that all day. The predictions are that it's not as bad as people feared. That's kind of like the bottom line. A few days ago, this enormous storm, one of the biggest in decades, was barreling up the Bay of Bengal. This, you know, they call them cyclones in this part of the world. They're equivalent to hurricanes. 120 mile per hour winds, enormous bands of rain, a tidal surge pushing the waters really high. But as it got closer to land, it kind of weakened. And right now it's moving inland. There's a lot of rain. There's some flooding. But we've only heard of a couple, you know, tragic incidents of people dying, property damage, but nothing catastrophic. So it seems for now that it hasn't been as bad as people feared.
Well, at least that's a little bit of good news. Jeffrey Gettleman, thank you so much.
My pleasure.